Write patient information. Take out the CD loaded with Holter software. Insert the downloader to open the Holter software when software installation done. Remove the battery cover of Holter Recorder, then connect the recorder and computer with USB data transmission cable. Connect the recorder to the computer through USB data transmission cable. After waiting for the Write Patient Information button to be operational, select Write Patient Information on the main interface of the software. Fill in the patient information and enter it into the recorder. The recorder that can be quickly initialized with Holter analysis software, and configure the pacemaker detection sensitivity, and edit the patient information and synchronize the recorder time. For the setting method, see the user manual of Holter analysis software.
Now we will introduce the connection method of simultaneous 12-lead Holter, 10-lead patient cable, composed of 4 limb leads and 6 chest leads. Before preparation, connect each lead wire to the electrode and prepare 2 3A batteries. This is the recorder. They are all preparatory work before formal operation. Before attaching the electrodes, wipe and clean the skin where the electrodes placed with alcohol, 75%, and then connect the electrodes after cleaning. Now, we will introduce the electrodes placement. Right upper limb lead. First intercostal space on the right midclavicular line. Right lower limb lead. Any intercostal space between 2 ribs of the last 3 ribs on the right midclavicular line. Left upper limb lead. First intercostal space on the left midclavicular line. Left lower limb lead. Any intercostal space between 2 ribs of the last 3 ribs on the left midclavicular line. Chest lead C1, fourth intercostal space at the right border of the sternum. Chest lead C2, fourth intercostal space at the left border of the sternum. Chest lead C4, fifth intercostal space on the left midclavicular line. Since the C3 is at the midpoint of the C2 and C4 connecting line, the C4 should be pasted first. Chest lead C3, fifth rib between C2 and C4. Chest lead C5, left anterior axillary line at the horizontal level of C4. Chest lead C6, left mid-axillary line at the horizontal level of C4. After pasting all the chest leads, it can be observed that the position of C1 to C6 lead is at the same as that of conventional ECG, only the limb lead is different. After connecting all the electrodes, check whether the electrodes are firmly pasted or not. Insert the patient cable connector into the Holter Recorder socket. and then install the battery in the Holter Recorder. Then check the waveform on the recorder screen and see if there is any interference. Press F2 to switch any 3 leads for real-time viewing. After confirming that all lead waveforms are correct, press and hold the blue Start Event button for 3 seconds. Wait for the blue light to flash and then put it into the backpack. Let the patient carry the backpack, who can move freely with it. When sleeping, patient can put the backpack and the strip by the bed without affecting the rest. Precautions for wearing Holter. After wearing the recorder, the patient can carry out the various daily activities, such as going to work, walking, doing simple housework, etc., and it can make life records and record discomfort events. Do not take a bath. Do not wear high static electricity clothes, such as polyester. Avoid contact with strong magnetic field and electrical field, so as to avoid distortion of ECG waveform and influence of excessive interference on diagnosis report. It is strictly forbidden to scratch the attached electrodes, and the upper arm should not move in a large range. ECG of Holter is often affected by the patient's position, activity, emotion, sleep, and other factors in the monitoring process. Therefore, the results detected by Holter should be combined with medical history, symptoms, and other clinical data to make a correct diagnosis.
Stop recording. After recording, the patient shall remove the recorder. With the help of the doctor, remove the battery from the recorder and then remove the patient cable and electrode from the patient. Data import. Connect the recorder to the computer through USB data transmission cable. Select Read Recorder on the main interface of the software, and complete data import after confirming that the patient information is correct. If the patient with pacemaker, the pacemaker detection be checked on the patient information interface. If the H12 series recorder adopts the 7-electrode patient cable, selecting 12 lead to 3 lead for data import can generate 3 lead ECG data.
Attention!
Follow the above sequence strictly, otherwise it may cause serious interference with the following waveform. After recording, import the data before recording the next patient. If the recorder detects low battery in the recording process, it will automatically stop recording. Please replace it with a new alkaline battery, and the recorder will automatically start recording again.